So I'm Richard Dulcamara, I'm the head of sales here at Feedback Medical. I want to talk about a subject that was recently brought up at the NHS Confederation event where Sir Jim Mackey mentioned the whole tearing up the outpatient model. So the number one priority across the NHS at the moment is reducing the elective wait list. We have 7.6 million people waiting for an appointment. The majority of that are for outpatient appointments. Now, we're operating under a traditional outpatient model whereby patients come in for a face-to-face consultation where a lot of the time is spent collecting patient history. Now, this is a model that was developed in the 1940s and it hasn't changed since. So here at Feedback Medical, for the past 3 years, we've been piloting a symptom-based asynchronous MDT outpatient model. And what that really means is this is about enabling a new transformational approach to outpatients through digital. We take patient records from primary care, we hold them remotely. Patients go for diagnostics at the newly formed community diagnostic centres, and we draw that rich information into Bleeper, and then we remotely present it to the specialties that might be involved on that symptom-based pathway. With this new pathway, we completely cut out the oscillation that patients experience going from specialist to specialist, trying to find answers to their symptoms, and we turn a traditional 20-minute to 30-minute outpatient appointment into a 6 to 10-minute online remote review. So obviously, automatically you can see there are great productivity gains to be had from the same clinical workforce. So the traditional outpatient model is based on a kind of linear pathway where a GP will refer you in to see a specialist based on what they assume to be wrong with you. And the problem with that is quite often the symptom they're experiencing could be down to a number of different reasons. And specialists generally only look at their specialist area. So often you've waited your 20, 30, 40 weeks to go and see a specialist and get to the front of the queue only to be told, sorry, this isn't one for me. I'll make a referral over to my colleague in another specialism. But that again will take time for you to go and see them. So this is where we hear about patient stories. They get bounced around different specialties, taking years in order to get a diagnosis for their symptom. Hence why a symptom-based pathway with straight-to-test diagnostics based on a referral mechanism and the pathway definitions means we can cut out first outpatient attendances and really significantly reduce a referral to treatment time and the referral to diagnosis. From the patient's perspective, the patient goes to see a GP, they go to a community diagnostic centre, and then in 90% of cases from the pathways we've worked with, the patient is sent back to primary care with a fully managed care plan. And only those who really need to go into the hospital actually are then brought in and referred in for an outpatient appointment. So better for the environment, better for the patient, and more efficient for the NHS.